Choosing health benefits can feel a bit overwhelming right now, but it doesn't have to be. Actually, joining us now to provide some easy tips to help people understand their options and choose the right plan to meet their health and budget needs, we have Eric Swain, Vice President of United Healthcare of New England. Hey, Eric, welcome to the show here. Hope you're doing well. So the first question to throw your way is, what should we know about open enrollment? How long does it last? Anything new this year?
Yeah, good morning. Thanks for having me. So what should you know? The most important thing is you're probably in the thick of it right now. So open enrollment for most people that have employer-sponsored plans runs sometime in November. So right about now. Typically lasts 2 to 3 weeks. Keep an eye out for announcements from your employer. And I would say one of the most important things you need to be aware of is pay attention to it, right? These are important decisions. Typically, you make a decision once a year, and that lasts the entire year, so all the way till next open enrollment. So really make sure you're focusing on what's available to you, what options are best, what's best for you financially, what's best for you and the care you think you might need during the year.
Yeah, that's a good point right there, especially the financial part, because as you're in the shopping cart adding things to your plan, it's like, uh-oh, I'd like that, but I don't know if I can necessarily afford it. So what tips should somebody know when it comes to picking a plan? Is there something that should be involved there?
Yeah, I would give people that are entering into open enrollment probably 3 tips. First of all, take the time, right? Don't rush it. Most employers have really good tools to help you through open enrollment. And the best thing you can do is go through them step by step. So don't rush it. Take your time. Number 2, focus on the cost. You hit on that a second ago. These are big financial decisions. So make sure you're focused on what the financial costs are and how they fit your needs. And those really fall in 2 areas. First, it's the premium. So how much does it cost you? How much will your employer take out of your paycheck to pay for the coverage that you're getting? But the second thing is then the out-of-pocket cost. So you bought this plan. Now when you go to use it, many plans will have a deductible, a copay, a co-insurance. So you need to be aware of what it costs you once you go use those. Typically, when the premium goes up, those employer costs go down and vice versa. So a lot of it's dependent upon your particular needs. So if you're healthier, you may want to pay less out of your paycheck and be willing to pay a little more in those out-of-pocket costs if and when they happen.
Very good.
So that's probably one of the most important things you can do. The last thing I would say is make sure you confirm the coverages. So make sure your doctors or providers are in network. Make sure the prescription drugs you take are in the right tier. Make sure they're covered. Just make sure the plan covers what you're going to need during the year.
Very good. And as we wrap up here, how about COVID-19? Is there anything new in these plans that maybe somebody should try to get in on theirs?
I tell you, it's hard to imagine anything really good coming out of COVID. But one of the things that's emerged as a result of COVID that is really positive in healthcare is this emergence of telehealth. So this idea that you can have a visit without going to the doctor's office, right? You can do it right on the computer screen or even on the phone. And that's been really important for people. And I think the future of telehealth is really exciting, right? People can get care they need without leaving their home. And one of the most difficult things about healthcare are these, kind of gaps in care. People not getting the care they need because they don't have the time to go to the doctor. Or maybe it's too expensive. Maybe those deductibles we talked about are getting in the way. Telehealth eliminates all of that. Most telehealth visits are very inexpensive. Most of our plans actually cover telehealth at a $0 copay. So it's really an efficient and effective way to get that care. But it's also a way to make sure that people that need care can get it. So they're not missing a care they might really need. So telehealth is really a great thing going forward.
Very good. Eric Swain, the VP of United Healthcare of New England. Hope you stay well. Thanks for coming on today and giving our viewers some tips.
Thanks for having me.